if you want to just sort of give us the standard elevator pitch for Read by QxMD.
Sure. So the reason why we built Read was to find a solution to connect clinicians, healthcare providers, doctors with the source of much of medical knowledge, which is the medical research. Many people would be a bit disillusioned to know that actually finding research which is relevant to your practice can be really, really hard.
Sure.
You know, I'm personally an internist and a nephrologist, a kidney specialist, and recent research was done which shows that at least 50% of the research which is relevant to my own practice is published in journals not even in my own field. So discovery of the medical literature that's relevant to me and that would impact my patients is really hard. We looked at the model of Flipboard and Zeit, where they look at consumer topics and try to personalize that content for you, and figured we could do the same thing for medical literature. So we spent, about a year building out this application on a very robust back end to create a personalization engine for the medical literature. And we do that by interfacing with the PubMed database, which we have a license to use from the National Library of Medicine. More so, getting access to content is also very tricky in the medical literature. If you look at the web, it's very easy to click on a link and get full text content. When you go to the medical literature, much of it is behind paywalls. Those paywalls are very complex. Most people who have access do it through an institution, either a hospital or a university. But have you ever tried clicking through to an actual article through one of those services? It's very challenging. So what we've done is we've taken that entire 5-minute frustration and convert it into one tap to get a full text article after we get your credentials in our system. So really it's about connecting people with personalized content and then allowing them to actually read it and not have to negotiate paywalls.
Great. It's very interesting. You also touched on something I was going to talk about in the next question about sort of your design inspiration for the app, and you mentioned Flipboard and Zeit. Were there any other sort of inspirations you took from other apps out there for the design of the app?
Our app design was, we like to think very much homegrown. In terms of concept, we certainly took a lot of the concepts from Zeit and Flipboard and other social magazines. In terms of design, we have a fantastic lead designer named Chan Cruz, that's Kruse, who really, I think, came up with some of these designs from scratch. So really, we tried to be inspired mostly through our own design process.
Great. So I think you may have already touched on this. How did you choose which journals were included in the app, and if there was a submission process, or if there will be a submission process in the future?
Yeah. So we want to be as inclusive as possible.
Sure.
What we want is that no matter what somebody wants to read, we can connect them with that content. So what we did is, to start off with, we had to start somewhere, we took about the top 360 journals for all the various specialties of medicine, and we've allowed people to subscribe to those journals. That being said, if you search for one of the an article that falls in a journal that's not one of the 360, we can still connect you to content. We just don't have subscription services set up yet. Coming in the next couple weeks, actually, though, you'll see that our subscription numbers will go to about 6,300 journals. Our long-term goal is we don't want a submission process. We want to connect people to all the content that's there.
Sure. So you're going from the 360 you started with to 6,300. Is that what you said?
Exactly.
In one update.
In one update.
Was there more? I guess the question would be how did you go about doing that so quickly?
So we previously were doing it very manually, and we've now switched over to algorithmic compilation of journal subscriptions.
Okay.
It's gone from a brute force effort to a smarter effort, and it's served us very well. Makes
perfect sense. It's very interesting. Are there any plans to add sort of more news-like sources to your app in the future instead of just journals? Obviously, I'm thinking of things like our own website, like medicaleconomics.com or urologytimes.com, or...
Yeah, so at some point, absolutely. I do think that including medical news would be a great addition. That being said, we're very much of the mind that we want to do one or two things very, very well.
Sure.
And there's a lot of people out there curating medical news.
Right.
I think some people have done a very good job of it. What hasn't been done well to date is really personalizing the medical research. And one of the concerns we have about medical news is often it takes research and filters it. It comments on it. It repackages it for the clinician. What we really want doctors and other healthcare providers to get back to is the source of medical knowledge, which is the actual research itself.
Sure.
That being said, once we tackle that problem and have done an adequate job with it, there's no doubt in our mind that moving on to medical news would be a great addition.
All right, that makes sense. Is there any plans in the near future to sort of, as a temporary solution to people maybe looking to read news on your app, to include the ability to add RSS feeds to the app and that sort of thing?
We haven't done that. I mean, that's very much by the Flipboard model, that you can add custom content yourself. We've taken the decision that using our algorithms, we think we can predict what people want to read, and so we're focusing on that for now. We do allow customization, and the areas that we're going to support customization are in the areas of picking journals that are more interesting than others, that perhaps our algorithm would not have picked for you because of niche interests that you might have.
Sure.
We're going to let people choose article collections that are out there in various journals. And coming soon, we're also going to have a keyword or search term feature where people can say, for example, I'm very interested in atrial fibrillation, and we'll specifically focus the personalization on those terms which you've given us. So it's not RSS feeds per se, but it is a higher level of personalization.
Sure. Are there any updates for the near future that are planned that you can talk to me about, other than obviously the one that's going to add significantly more journals?
Yeah, our next big update really is about expanding our pool of subscriptions.
Sure.
We know that right now the workflow, for keeping up to date with a specific journal of interest is also very broken. Traditionally, people either wait for a journal to show up in their mailbox, which there's obviously a delay there, or for people who are more tech savvy, they'll sign up for an electronic table of contents, which will be delivered to their email inbox. Also a very broken system, because once you get a list of the articles which you might be interested in, going and actually finding that article is quite challenging. So what we've just done is implemented a push notification system, which will integrate with this now pretty massive journal collection, so that every time a journal you subscribe to has new articles, you'll get a push notification on your iOS device, either an iPhone or an iPad. You'll tap on the notification, and the actual new issue of the journal will just pop up. So that's really what we're focused on right now, trying to get people the content as quickly and as simply as possible, and in a very timely fashion without any delays.
And that push notification system is going to be coming out in your next update?
It's already actually live,
okay.
but of course it's only functional for a subset of the journals.
Okay.
With the next update, it's going to be very, very inclusive for people with many, many interests in clinical medicine.
Okay, interesting. Okay. When I was going through the app, I didn't see any advertising on the app, and obviously the app's free, so I was curious if there were plans, or are you currently monetizing the app in some way?
Yeah, so we're not monetizing the app in any way right now. Our long-term plans are that we will certainly need to at some point.
Sure.
We do have other apps that we have been selling for some years now, which certainly supports our development at present. We're looking towards primarily what will probably be a freemium model. So the basic functionality will be available for free, and we'll be adding other layers of services and features for those who want to buy a premium version of the application.
Sure. Are there any concrete plans on that freemium version yet? Like, what sort of features do you think you might be including?
Yeah, exactly how that will work, it hasn't been sorted out. We're really more focused on getting a really amazing basic product.
Sure.
What we will likely be doing is having a presence on many devices: iPhone, iPad, web, Android, what have you, and allowing people to take all of their content and have all their content stored in the cloud and accessible anywhere they go, sort of the Evernote model.
Right.
And that's likely going to be one aspect of the premium aspect of the application.
Okay. Who do you see as your competition, and what makes your app stand apart from them?
In terms of our competition, I really think that our number one competitor is apathy.
Okay.
That right now, I think that there's a lot of clinicians out there who find keeping up with the medical literature so challenging. Scrolling through 10,000 articles a week that might find a few that are relevant to you. It's just something that people don't have the time to do.
Sure.
We really believe we're providing a service that otherwise people would simply just not engage in. They would not review literature adequately, and if they found an article of interest, they may just not read it because it was so inaccessible. That being said, there are other companies who are doing some things that are similar to our space. There are some companies that produce a product, for example, like Papers, which I'm not sure if you're familiar with. It's an app that helps organize all of your medical literature or your scientific literature. It's actually a great app. It's not really a competitor to ours in that, although they do provide a reading experience, they're not really about personalizing content. That's, I think, what our focus is trying to figure out who you are, what your clinical practice is like, what your scientific interest may be, and give you an experience which is very personalized. There are other applications like PubGet. PubGet, I'm not sure if you've heard of them. Yeah, what they've done very, very well is help to do search and connect users to full text. That's certainly a part of our offering, but not the entire offering. What we do, again, is personalization of content, and getting access to full text content is simply a tool that is required to complete the service.
Right. All right. Let's see. Oh, how are you guys currently promoting your app?
So right now, it's mostly through word of mouth and a spread through existing users. We have other applications. The most notable one would be an app called Calculate. Yeah, so Calculate has been downloaded by about 650,000 users, and that user base knows us, and I think they trust our products, and so we're seeing a lot of our downloads coming from existing user base.
Okay. So you're sort of cross-promoting Read within Calculate.
Exactly.
Got it. Yeah. And how many downloads have you had for Read so far?
We're just, I think, about the 20,000 mark. So still, slowly growing, but it's, exciting growth, and we're seeing it pick up the pace.
Interesting. Let's see. Oh, I noticed you're on both major platforms, iOS and Android, and even BlackBerry for some of your apps, but is Read available for all of those as well?
So right now, Read is only available for iPad and iPhone.
Sure.
We are certainly interested in coming to other platforms. It'll really be dependent on how quickly we can build and support platforms well enough.
So there are plans to create an Android version of the app and that sort of thing in the future?
Our exact development plans aren't firm.
Okay.
Most certainly, we would like to support HTML5 web version, which we hope then will allow access to other devices before there's native applications available.
Okay. And just a sort of last question. I talked a little bit about Calculate. Are there any other apps that you wanted to maybe mention while we're talking?
Yeah, sure. Our two other apps that are, I think, probably the most interesting aside from Read and Calculate are PDStat and ECG Guide. ECG Guide and PDStat have been around for quite a long time, and I think are pretty well known among our user base. ECG Guide is an educational tool to learn how to read electrocardiograms, and PDStat is a critical care app for docs who look after critically ill children. And so they're been around for a long time, and we're very happy with them.
Okay, and I don't think we touched on what exactly Calculate does.
Sure. So Calculate is a medical calculator, hence the name Calculate.
Sure.
But it's become really more than that. It's become a clinical decision support tool. So for various clinical scenarios, there's often research which suggests how we can prognosticate better, or treat more accurately, or diagnose more accurately. But the tools available are often very complicated to use. They often involve complex math, sometimes natural logarithms, certainly not math that people are going to remember or do in their head. And so what we do is give people a simple interface which allows them to use that medical research and apply it in clinical practice.
Great. I don't think I have any questions left.
Okay. Well, thanks very much.
Yeah, thank you so much for taking the time out to talk to me.
No problem. Talk to you later.